So the Greater Sydney Commission was only formed early last year. We're a very new government agency. Lots of cities, probably cities across the world that where you're from, may have a planning commission. Greater Sydney didn't have a planning commission, so we were formed last year by an Act of Parliament, and our agency was definitely set up to provide that glue between the sort of the state government agencies, the local councils, the community, business sector, all the stakeholders, and the federal government.
For me, whilst I very much am committed to the needs of people who have a lived experience of severe mental illness, the fact is that we will never get there. There'll never be enough money to do that unless we find a better approach to our community's wellbeing generally.
It's interesting that a lot of people sometimes think, well, you know, what role does planning play? It's really just, you know, colouring in or putting boxes in different places. But planning has a really major role in our health and wellbeing.
The match being hosted by the Greater Sydney Commission is a really exciting development in the mental health field, because what we're trying to do is to make sure that we actually push a wellbeing agenda, not simply a being not sick agenda. And often the focus in mental health often is about acute mental illness. It's about when people get sick, what happens to them. And the fact is, if that's all we ever do, there'll never be enough hospital beds, there'll never be enough doctors to treat them.
Where things are located and how you connect to them affects your day-to-day living. It affects how time you spend with your family, the stress that you're under, you know, how much exercise you get, all of those things planning impacts on, and that's the important role that we need to recognise and understand.
Well, this match is really important because if you look at what's happening around the world, as more and more people move into cities and urban lives, that is the most difficult, most complex environments to be able to provide the supports people need to thrive in their lives.
One of the things that I really like about the Glasgow experience, which I think is an interesting one, is that their slogan is that people make Glasgow. It is different than buildings make Glasgow or the geography makes Glasgow. It's all about the people. And the center part, which I think we're really trying to help get the focus on, is what is it that helps people thrive and flourish? Yep.
I'm really passionate about developing mental health education, literacy in low middle income countries, and I think that a match like this, if we can all come together and think about big cities in, say, Bangladesh, Dhaka, in Uganda, in India, and think about how we might be able to impart knowledge but also learn.
The Greater Sydney Commission match in this project has been tremendous for us. It's been exactly the sort of thing we're after, to try and encourage more thought and more discussion and more input into making communities that flourish. Our council's in a very unique position in that we're just on the fringe of Sydney, and we've got a growing population, a population that's growing very quickly, and we're going to be creating a new town at Wilton Junction, a town of ultimately around 50,000 people. We've used the opportunity with the growth we're facing to look at health and well-being and community, building communities in such a way that we're taking every advantage we can with the growth that we're experiencing.
The idea that mental health planning can be used to enhance the mental health of the community is something that I personally had not thought through. I've heard so much today that I think I could take back to my colleagues in England, and I know my colleagues from other countries will take back, because we've traditionally probably seen planning as something that's about roads, buildings, health and safety. We haven't thought about it. How do you put planning into making health matter to the community, and how to ensure that the community has access to appropriate resources, and planners coming together to facilitate discussions that need to take place between different levels of government, different agencies, who often exist in their own little silos in all of our countries.
I think it's just as important to be dealing with the human infrastructure and the soft infrastructure as it is to deal with the hard infrastructure. In fact, when you think about it, the two things aren't really all that separate, because the more effort and the better you can successfully achieve thriving communities, that has implications in terms of communities working together and combining together to get the best outcomes.
A lot of attention to health equity. This is a complicated graph, but I put it here because I just want to again get a sense of how we've tried to be systematic about addressing disparity and equity. One of the things we know in our system is that communities of color access services at a lower rate. Partnering with University of Pennsylvania, what we did was geo-mapping, which in part explains some of that disparity. And basically what this graph says is that for African Americans, the low utilization is explained in large part by fewer providers in the areas that they live. So what that meant is that we did RFPs specifically for those requests for proposals, specifically for those areas, which is sort of in contrast with a lot of the work that is about how do we make providers more culturally competent. I believe in that, and in fact what we did is when we infused these new services in, we did do a lot of that work around cultural competency, but the structural issue was the thing that we had to deal with first. I think that planning and mental health is a light bulb moment because historically that hasn't happened. Typically the people who plan mental health systems plan them independently of the people who are planning what's happening within cities. But if you think about it, cities and city government is a part of government that touches the people on a daily basis. And the fact that historically most cities have not integrated mental health into that, I think it's been a real missed opportunity. This is one of the examples that I am most proud of. This is work that we've done in training providers in trauma-focused CBT for children, best evidence treatment for trauma in children. These are the places that we have these programs all over the city. But what we've done is, what we do is we will screen kids in primary care settings, identify those kids who are screened positive for trauma, and then connect them to one of these programs that is in their community. So over the last several years, we've probably 2 or 3 years, we've screened about 30,000 kids. About 10% of them have screened positive, and then they've been referred to these kinds of evidence-based treatment programs.
What we saw today was absolutely fantastic. The film where actually some guys who really could be seen as being in the outside of society, who are often forgotten by society, were able to be empowered and supported to be able to produce something so meaningful and important, not just in their lives, but it's going to touch anybody who sees that film and give them a glimpse of the actual reality of how so many people in society live. In addition to that, I would say what I thought was amazing today was the actual film and videos of the young men who'd produced such incredible music despite having such a lot of barriers to overcome in relation to their own access to instruments and their own access to traditional music forms. So actually being able to be supported and facilitated and empowered to do that, and then you could just imagine not just how life-changing it is for them, but also just how good and the high quality the music was.
It's important for us to be working with international colleagues and sharing information and sharing knowledge. So it was really good for us because A great deal of our participants and community members live with mental illness, and a lot of our projects seek to find new ways through art and community development to improve their lives in some way, and ultimately through sharing of stories and creating of fine art, we hope that we might be able to improve people's lives.
I am ecstatic that I came. People are wonderful, they're nice, smart people who are doing innovative things. And I think for me, what's been really rewarding is that there are people with similar views of the world, that we can't be in our little black boxes over here trying to treat people. We really have to think about how we influence the broader community. And to sit around the table with people who have that same perspective has just been very invigorating for me.
This match has been highly successful. The finding out and learning about what the Greater Sydney Commission is doing, along with what Arthur Evans has done in Philadelphia, has been such a unifying experience. And we're leaving Sydney with a lot of energy, a lot of anticipation, and determination to make this ongoing.